Let's say there's a hut on fire, like we usually say in the village, a hut is on fire. You know that the possibility of this fire spreading from one hut to another are quite high. So what you do as a village at that particular moment is not to say who's a woman, who's a child, who's a man, who's what. It's everybody, whoever can grab a bucket of water, sand, whatever, in order to quench that fire. Basically, that's what we've been doing with HIV and AIDS, where we've been saying, everybody who's got resources, whether you're an international partner, you're a government, you're a local partner, you are who, can we all come together, quench this fire? And then we can talk about the reasons why this fire was there in the first place later.
I think many other partners that are working with us now may never realize who changed the way we do things. But we have the skills today, we have the competencies, we have the abilities, basically because LPCB with little resources came to change the way we think, the way we do things, and the way we remain accountable to the donors.
LPCB is the Local Partners Capacity Building Program. It's a USAID funded project aimed at building the capacity of local organizations throughout all of Zambia.
USAID's experience was that in trying to get resources to where they could be applied to address the pandemic, they found that many organizations were unable to absorb the funding to apply it effectively.
There's quite a bit of emphasis now from donors. They're putting a lot of emphasis on local NGOs being strong enough to become prime recipients of funding so that they can implement projects well.
Welcome to Chilengwa Basic School!
Our goal when we started the theatre group was to just make money.
When your partner is HIV positive and you are not, it doesn't mean that's the end of the road.
After we had opportunity to partner with LPCB by that time, then we changed our focus. So instead of raising money for ourselves, we can raise money and start doing interventions on HIV.
So the best way for you to know your HIV status, if you are infected or not, is by going for VCT. VCT simply stands for voluntary counseling and testing, maybe if you don't know.
We are now able to attract people to come and to trust what we are doing, because when they look at our strategic plan, they look at our financial guideline, they are able to trust us.
Unlike many capacity building programs that offer organizational assessments or provide standalone training, LPCB offers an integrated approach. So the organizations begin with self-assessments where they identify their own priorities, and then they attend relevant training in areas ranging from governance to strategic planning to fundraising to HIV/AIDS programming. And then they put those new skills and systems into practice with the support of grants and mentors and coaches.
We'll not create a consortium if we partner with people at the point of implementation.
We have taken a process facilitation approach in which the facilitator accompanies the organization through the life of its relationship with the program, beginning with a facilitated self-assessment.
What we did, the board and the management, we sit together, oh, this is our gaps, what are we going to do with these gaps? And we assessed ourselves. No one was assessing the organization, but ourselves. We were assessing and marking ourselves to the level where we were. And through that, we developed the improvement plan.
They identified organizational development facilitators who would essentially play the role of being with these organizations to see them develop the processes that they had agreed were things that they needed to work on.
They assigned ODFs, they did monthly evaluations, and that really made each and everyone at CBTO to pull up their socks in whatever areas they were weak in, and it worked perfectly and beautifully well.
The ODF gives you an opportunity to grow, but their role is to prod and just to make sure that you own the process yourselves and you drive it.
That mentorship, it really helped us because those people, the capacity leaders, they were coming to work with us closely. When we are developing the manuals, they were there. After we have developed the manual, we send them, they go through them, they advise, and we also work on our own. So it really helped us.
We've seen small community-based organizations do so much with just giving some equipment has made a huge difference.
Welcome to Pride Community Health Organization, an organization that was established in 2003 for people living with HIV and AIDS. Pride has a website now that is running. It also has a Facebook account. It has a Twitter account, which is all thanks to the commodity grant that they received.
Of course, before the LPCB joined us, and we did not know how to file. No proper filing positions. As we are talking now, even monitoring, evaluating, it is simple because of machines that we have. Also, we have found everything simple.
The HIV program in Zambia is quite big and the impact is quite big. And what Bethesda is doing through LPCB is evident by the number of people that you saw and what people are saying.
Me, I can counsel a patient who is bedridden HIV. I can go there with a word of consolation. I can counsel that person. He will rise up and understand.
We have now the capacity to run our own affairs. And we are also able to attract other donors apart from LPCB. That's what graduation would mean. Of course, it's not just an occasion, but also looking at the capacity that has been built in Bethesda, Zambia.
We are going to look at how this disease, AIDS, progresses from the incubation, from the time somebody is infected up to the time it comes to be known that this person has the AIDS.
So under the service grant, we have targeted 200 young people in the safe space programs. Before the IDF, we had only one donor, which was Global Fund. We have all the systems in place that donors are asking for, and which LPCB has helped us to put in place.
A long time ago, we would have one child receiving support from 3 organizations. And now, since we've been coming together and collaborating to report and get data, even when it comes to identifying which OVC you're going to support, this has increased the number of beneficiaries receiving support.
Our organization development facilitators have taken to this model and have gone as far as to form their own organization. It's called the Institute for Organization Development Facilitators, and we have supported it to become independent. It will remain when this project has ceased.
Each one of us is bringing a different comparative advantage, and therefore each one of us is implementing something different.
Nurturing and ownership, those are our beliefs, things that bring us together at the heart of the IODF. I think in the past, the way we functioned was like each one for himself. You have a client, you just do what you have to do on yourself. Now, with the IODF, a platform has been created where there will be this coordinated professional development in OD, at least in the country.
that's the mark of success, is first of all in terms of is quantitative, by the number of partner organizations that have graduated, but also in terms of quality. I mean, the number of organizations that are better off, today than when we started.
We have now more capacity. Now at this stage we are running what we call a task Catch Them Young in schools.
Every person in Catch Them Young has been given an opportunity to speak out and to teach others on the effects of HIV and AIDS.
We are even targeting applying for bigger funds because we have that capacity. So the future of CB2 is actually brighter than it was in the past. That I would guarantee.
They've left us a better standard that we are able to continue on our own.
They came with a revolutionized way of doing things, change people's mindset, change the way they see things and leave them to begin to survive. They merely came to lit the candle and the fire kept burning, and today we are where we are with multiple donors. We no longer have dependence on one donor because they changed the way we see things.